Hey, this is Joe with Grandview Aesthetics and Jiva Med Spa. Today I'm here with Ashley and Dr. Nanda. We're going to talk about Viveve. Exactly what is this procedure, Dr. Nanda?
So Viveve is a procedure that we use for women that suffer from something called incontinence or vaginal laxity. So what is incontinence is the big question. Incontinence is when these women are leaking urine at times that they don't want to leak urine. So a lot of women suffer from this. It could be related to childbirth, or it could be just that you've never had kids and you have a little bit of that urinary leakage. Other times you're like trying to jump on a trampoline and you're leaking urine, you're watching a movie and you're like, oh my God, I peed myself, that's never good. So we try to address that a number of ways in the medical world. We use medications, we use surgery. Viveve is an answer that uses a non-laser oriented approach that can actually fix this. And Ashley here does that procedure.
Ashley, how long does this procedure take? What exactly does it entail?
It takes about 30 minutes. I expect my patients to be with me about 60 because I have a small little questionnaire that we go over. We go over our health history, we go over any kind of other problems that they're having, and the actual procedure itself takes about 30 minutes. It's non-invasive, there is absolutely no pain at all, and I want the patient to be super comfortable. We actually talk through the whole procedure, and it's very nice and natural for them.
And Ashley, is there any way to tell that this is a great procedure for you? Any telling signs?
Well, for one, it's a great procedure all in itself because it uses the radio frequency that again does not hurt at all, and it also helps with all of those incontinence that Dr. Nanda touched on, and very doable for anybody, so they don't have to miss work after that, have any pain, have any discomfort. So there is lots of benefits to this as well.
Yeah, that's actually something I love, is that they don't really have any downtime. They can go right back to work, and there's no pain. It's not a laser. I know a lot of people don't want to do laser-oriented procedures in the vaginal canal, so this is not a laser-oriented procedure. It's radio frequency. So.
How does it work between the two of you? Do they come in and see you, Dr. Nanda, and then go to Ashley?
So
do they have to?
They can go in either direction. Ashley's an OB nurse, and so that's why I have her doing these procedures with me. So they can come visit with Ashley. She can do the whole consult. She can do the procedure the same day very often. Other times they may want to schedule in a week or two later, or they can come see me in either direction. But they can visit our website, greatskinohio.com, or they can call us at our office, 614-421-SKIN, and they can schedule a consult.
And you said it was radio frequency or laser. Exactly what does that mean?
So lasers are one type of device. Radio frequency is another type of technology. So when it comes to lasers, a lot of people don't want to do a laser-oriented procedure. So this is a radio frequency device, but it gets extremely great results. It's actually similar, if not better, than the laser-oriented vaginal procedures.
And Ashley, how long have you been doing this procedure?
I have been with Dr. Nanda for almost a year now, so I've actually started doing it as soon as I came on with him in May.
Yep.
So.
And have you seen a lot of good results?
I have. I would say roughly about 85 to 90% of my patients have experienced a wonderful drastic change with their incontinence. They report to me that they've gone down from like 3 to 4 pads a day to 1 to none.
That's amazing.
So it's really an
amazing
procedure for people.
The other cool thing about this is that it's only one procedure, so as opposed to some of the other ones where they have to do multiples, this is one and done. It's about 30 minutes and you're done and you're finished. So that's the other advantage, is a lot of people don't want to do multiple procedures. So they'll do one and then they're done with this one.
And is there any pain or discomfort with this procedure?
No, like I said, there is absolutely no pain. The actual piece that goes, that we use is literally the size of a thumb. So the patient does not feel like anything. I make them very comfortable in our environment. We talk the whole time. And when they come in for a consultation, and even the day of, I do go over everything that we're gonna go through and give them a heads up of everything to expect. But absolutely no pain with this at all, no.
And so they would call and make a consult and then get scheduled for the treatment, or is it a same-day treatment?
No, they would call and make a consult, and we would go over some paperwork. We would go over medical history, do any kind of things that we need to do before, if there is anything. I would include Dr. Nanda on the consultation, and then we would get them going. We would get them scheduled.
And there's no numbing needed with this, by the way, because it's not a laser, so there's no numbing needed. You do this, there's actually zero pain. There's absolutely no discomfort with this, and you go right back to normal activities.
Yes.
Anything you want to do afterwards.
And Dr. Nanda, is there any medication or anything required after the procedure?
Absolutely none.
Nope.
None.
And Ashley, how could one make an appointment for this?
they can make an appointment by calling our office, 614-421-SKIN.